All right, let's get right into it. If you're anywhere near Metro Atlanta, you've probably noticed this flu season feels different, a lot different. But there's a specific kind of hidden danger that goes way beyond just a fever and feeling wiped out, especially if you have a surgery coming up. We're going to break down exactly what is going on. So let's start with just one number, over 500. That's how many people just in the 8-county metro area have been put in the hospital with the flu since October. This isn't just a bad flu season, you guys. This is putting a serious strain on our entire healthcare system. So what's driving this thing? Well, the answer is a specific new strain of the virus that is proving to be, frankly, way more aggressive than usual. This is not your typical flu bug, and it's creating a whole new set of challenges for patients and for doctors all across the area. So, just how serious is this? Well, public health officials have put the entire state on the highest possible alert level. The absolute highest. And here's the chart that really puts it all into perspective. Yeah, flu activity is high pretty much everywhere in the US right now, but Georgia, we are in that very high category. That is the most severe label the CDC and the Department of Public Health can give. It basically signals that we're in a critical situation. And this severity, it has a truly tragic cost, 29. That's how many people in Georgia have died from the flu just this season. It's a really stark reminder that we are dealing with a deadly outbreak here. And the really scary part, officials don't think we've even hit the peak yet. They're actually bracing for these numbers to go up, not down. Especially now that the holidays are over and everyone's back in school and back at the office. It's just the perfect environment for this virus to keep spreading. So, let's actually meet the virus that's causing all this chaos. Yep, it has a name, and understanding what it is, that's the key to understanding the risk. It is called Subclade K, and all that really means is that it's a super aggressive mutation of the normal type A flu virus we see all the time. You can kind of think of it as the regular flu, but on steroids. So why is this one strain such a huge concern? Well, a few big reasons. First, it has what's called high virulence, which just means it's extremely good at making people sick. Patients are reporting this insane fatigue and really high fevers. And here's the kicker. This season's vaccine only partially covers it. That means the shot helps, but it's not a perfect shield. And this is where it gets real for the medical community. Anesthesiologist assistant Ariana Lyons puts it perfectly. She says, because that vaccine isn't a silver bullet, it puts all the pressure on medical teams to be extra careful. Every single patient screening, especially before an operation, becomes that much more important. Okay, so this all brings us to the real heart of the matter, that hidden danger this flu creates if you're scheduled for any kind of surgery. This is where the risk becomes really personal and, frankly, a lot more complicated. So let's just say you're one of the thousands of people in Metro Atlanta with a surgery on your calendar. What does this whole flu situation actually mean for your safety? Well, the difference is night and day. On one hand, you have a healthy patient, normal risks. But on the other, a patient with the flu, even with just mild symptoms, is suddenly facing a much higher risk of airway problems, the very real possibility of their surgery being postponed, and a way harder recovery. The stakes just get so much higher. So the key medical reason for this is a condition called airway hyperreactivity. Basically, the flu makes your airways incredibly sensitive. Think of them as being on a hair trigger, just ready to freak out and overreact to the smallest thing, like the equipment used during anesthesia. And that overreaction, it can be life-threatening. It can cause what are called bronchospasms or laryngospasms. That's when your airways literally spasm and clamp shut. This is a massive medical emergency, and it's most likely to happen at the most vulnerable time possible, right when you're going under anesthesia or when you're just starting to wake up. So, who is on the front line protecting patients from this very specific risk? That would be your Anesthesia Care Team. These are the experts whose entire job is to manage your safety and keep you stable through any operation. This team includes anesthesiologists and anesthesiologist assistants. They're the experts on how drugs and diseases impact your body. Their single most important job, their only job really, is to keep you safe from the second you go into that operating room to the second you leave. And to handle the threat from this Subclade K flu, these teams have a very clear playbook. First, they have to carefully check your airway for any signs of that hyperreactivity we just talked about. Second, they screen you for any active symptoms at all, even if they seem minor.
And third, they monitor you like a hawk after the procedure is done, because complications can still pop up.
Now, this means they have to make some really tough calls. As Ariana Lyons says, even symptoms you might just brush off, a little cough, a low-grade fever, could be enough for them to postpone a surgery. And look, that is no doubt frustrating. But that one decision is made for one reason and one reason only: to minimize the risk and keep you safe.
So let's zoom back out. What does this all mean for the rest of us? Let's pull it all together and talk about the most important things for everyone in Metro Atlanta to know right now.
Ultimately, what this whole situation really drives home is how critical it is for all of us to be educated about the risks and for our clinical teams to stay super vigilant. Right now, being informed is our absolute best defense against this thing. And it really leaves all of us with a fundamental question to ask ourselves. In a situation like this, where a sickness that seems minor could actually have major consequences, we have to decide what's more important: sticking to our schedule or prioritizing our health. It's definitely something for all of us to think about. Stay safe out there.